Comparison of ARBs and ACE inhibitors. This is the very important concept each and every pharmacist must have to understand. This difference has been divided into three unique points. The first point is the mechanism of action. ACE inhibitor, name itself indicating this is inhibiting the angiotensin converting enzyme. That means the primary mechanism of action is not converting angiotensin 1 to angiotensin 2. That means this conversion is inhibiting, so angiotensin 2 production is reduced in the body, and due to that doesn't cause the vasoconstriction and that doesn't cause any kind of aldosterone oversecretion. And we are getting the benefits in reducing the blood pressure. That's the mechanism of action of ACE inhibitors. ARBs on the other side, that is blocking the receptor. That means angiotensin 2 is already in our circulation system, but the receptors are blocked. That means angiotensin 2 is not getting opportunity to bind with the receptors and producing the effects. Okay, so this is the two unique kind of mechanism of action. That's the difference number one. Now, the difference number two is the ACE inhibitors names like ramipril, lisinopril. So all the pril words are ACE inhibitors. The unique one is captopril. Okay, captopril. That's different than all other ACE inhibitors, because normally ACE inhibitors are given once daily, but captopril is a different kind of medications that need to be given in multiple times in a day because the half-life is short. And the second important unique point about captopril is that contain the sulfa moiety. So that medication can cause the sulfa allergy related problems. But nowadays ramipril is most commonly used and captopril is least preferred medication. So name difference, prils are the ACE inhibitors. And sartans, losartans, okay, so that's kind of sartans are the ARBs. This is the second name difference. And the third difference is the side effect profile. Angiotensin converting enzyme is also required in clearing of the bradykinin. If the bradykinin is mainly in our lungs, okay, so angiotensin converting enzyme is responsible for clear of the bradykinin, but when we are blocking the angiotensin converting enzyme, in that situation bradykinin is not cleared off and that start accumulating. They start accumulating bradykinin that causing the problem in lungs as a dry cough. So this is the unique side effect associated with ACE inhibitors. The second unique side effects is that cause the angioedema. That's angioedema means the swelling of tongues, and due to that swelling of tongues and mouth, and due to that the choking. Okay, so respiratory problems can arise. These are the unique kind of side effects associated with ACE inhibitors, but ARBs doesn't have such kind of side effects. So the people, those who are taking ARBs, they are not experiencing dry cough, but the ACE inhibitor patients experience the dry cough. Okay, so this is the very unique point that you have to remember. And the two similarities, both ACE inhibitors and ARBs. The one is the medications are not preferred in pregnancy. So the pregnancy contraindications. And the second important point is that both the medications are affecting the aldosterone functionality, and due to that, the aldosterone is not releasing in a proper quantity, and that ultimately that is causing the sodium and water excretion and potassium retention. So it's a higher potassium level. That means both the medications, ARBs and ACE inhibitors, can cause hyperkalemia. Okay, so hyperkalemia is the side effect associated with both the medications. So we have to be very, very careful about the combination of the medications like a potassium-sparing diuretics or potassium supplements along with ACE inhibitors or ARBs that can significantly increase the level of potassium, and that can cause arrhythmia. Okay, so that's the interaction is also very important. And the third important point that we have to remember about the similarity is NSAIDs. Non-steroidal anti-inflammatory medications should avoid in combination with ARBs and ACE inhibitors, because this combination can acute renal failure can cause. Okay, so these kind of similarities and difference are very important and is a high yield value for your exam preparation as well as for your real life practice.